are you?
Good, how are you?
Good, thank you. My name's Lauren. I'm going to be the occupational therapy student assessing you today. So what we're going to be doing today is we're going to be measuring some movements in your joints to see how well they're moving for us. A tool we like to use is this. It's a goniometer. And this is basically going to give me an accurate measurement of how well your joints are moving. And it's pretty important to have those moving pretty well just because it's important for pretty much everyday activities. You're going to need those for things like eating, for washing your hair, brushing your teeth, showering, basic things like that. So you want to make sure that they're all moving well and fluidly together. So before we start, is there any pain that you're having today?
Nope.
No? Any questions?
Nope.
Okay, so before we take a measurement, I just want to take a look and see first and observe. So I just want you to follow the movements that I'm doing. So we're going to start by raising your hands above your head like this. Perfect. Make sure your hands are in. Good. All right. And then we're going to go behind your head. Perfect. Behind your back. Great. Come back to neutral and then just push those arms back. Great. All right. We're going to raise them up like you're doing a snow angel. Make sure those palms are towards me. Good. And we're going to go back down. Good. And we're going to come about midway. And we're going to cross in front of the body. And back out. Great. We're going to look at the elbows now. So we're going to bring your arms up and down. One more time. Up and down. Perfect. We're going to place your arms like this. Good. Flip those arms up and back down. Up and back down. Good. Now I'm going to take a look at your wrists. So I want you to put your wrists up and down, up and down. Come back to neutral, and then we're just going to go towards the side. Go out and back in, out and back in. Good. And then the last thing we're going to be looking at is just how well those fingers are bending. For the first measurement we're going to be taking is we're going to be doing shoulder extension. So what I'm going to have you do is I'm going to just see how far back you can push that arm back for me. All right, so what I want you to do is sit up nice and tall, good, feet flat on the ground, perfect. All right, so what I'm going to have you do is I'm going to have you hold your arm right next to your body, perfect. All right, my axis is going to be lined up with your acromion process. My stationary arm is going to be parallel to the floor, and my movable arm is going to be parallel to the humerus. So whenever you're ready, you can go ahead and move that arm back for me. Just push it back. Good, as much as you can. Okay, good. All right, so Daniela, the next thing we're going to be measuring is your elbow extension. So what I'm going to have you do is have your palm facing up and just rest your arm like that. Perfect. So for this one, my axis is going to be your lateral epicondyle, which I'm going to find now. Okay, good. My stationary arm is going to be parallel to your humerus, and my movable arm is going to be parallel to your radius. All right, good. So for accurate measure, I'm just going to have you bend that elbow up. Good, perfect. And this is actually measuring elbow flexion, but mainly we just want to make sure that we got a good accurate measurement for elbow extension. So go ahead and place that arm back down. Okay, perfect. Great. All right, so Daniela, the next thing we're going to be measuring is forearm supination. So what that's going to look like is, do you remember when we were flipping your arm up and down in the beginning? That's what we're going to be doing. So what I want you to start is just sit on the edge of your chair a little bit. Sit up nice and tall, feet flat on the floor. Good. Start with your hand like you're going to do a handshake. Perfect. Okay, so for this one, my axis is going to be on the volar part of your wrist. and my stationary arm is going to be parallel to the floor. And when you flip that wrist over, my movable arm is going to be following the volar aspect of your wrist. Okay, so whenever you're ready, good, perfect. And I know I'm touching your skin, I just want to make sure I'm getting an accurate measurement. Okay, perfect, good. So the next thing we're going to be measuring is your wrist extension. We're going to see how far back that wrist can bend. So my axis is going to be on the lateral part of your wrist, just distal to the radial styloid. My stationary arm is going to be parallel to the radius, and my movable arm is going to be parallel to the metacarpal of the index finger. Now what I want you to do is close the hand for me. Perfect. This isn't going to allow for passive insufficiency. And then once you're ready, just bend that wrist back towards me. Good. Good. Again, this closing of the hand is important so it doesn't allow for passive insufficiency. Okay, perfect, you can relax. Okay, so the last thing we're going to be measuring today is to see how well your fingers can bend. More specifically, we're going to be looking at your PIP joint and the flexion in your PIP joint. So this middle part right here of your finger, that's your PIP joint. So today I'm going to focus on the middle finger. So if you can just bend this one down for me a little bit, perfect. My axis is going to be on the lateral side of the PIP joint. My stationary arm is going to be parallel to the lateral side of the proximal phalanx. And my movable arm is going to be parallel to the middle phalanx. So whenever you're ready, perfect. Just bend that finger just like that. Great. Okay, good job. Perfect.